Hello all, this is Mrs.Lalithamani, Associate Professor from SNS College of Nursing. In this lecture series, we are learning about some other new topic every month. Today I have chosen an important topic that comes under the neurological disorders, coming under the subject adult health nursing too. So the topic is trigeminal neuralgia, where a person might be affected with the neural disorders and it might be treated. So let us start with the clinical features, how the patient is presenting to us. So it is the Mrs. Mary Johnson, 58 years, presented to the emergency department with the complaints of sharp shooting facial pain, and that has started approximately 3 weeks ago and has a progressively worsened in intensity and frequency. She adds to that she also has a pain sensation triggered by light touch, talking, eating or brushing teeth, or even exposure to cold air. So Mrs. Mary, presented to the emergency department with the complaints that she has a sharp shooting facial pain that started approximately 3 weeks ago and has progressively worsened in intensity and frequency. Light touch, eating, everything has stimulated, so occurs multiple times a day. So with this presenting features, we need to conclude that there might be problem in the nerve. So whenever there is an activity, the person is having a problem. So it should be with the nerve functioning. Either it should be with the motor, sensory, or the nerve. So when we think more sensory, if the patient has all these expressions of pain, so they sense it. So we are coming into the nerves. So the trigeminal neuralgia is a chronic pain condition affecting the trigeminal nerve in the face. So the nerve supplying the face will be the trigeminal neuralgic pain, that is the trigeminal nerve. So in that case, it is characterized by sudden severe electrical shock like facial pain. So a person who is presenting with the facial pain, and the complaints are like whenever there is an episode like eating, brushing teeth, or chewing, everything is increasing their pain. So that is why we call it as trigeminal neuralgia, where the trigeminal nerve is having an impact. So when we see about the anatomy of the trigeminal nerve, it is the fifth cranial nerve, and it has 3 branches. One is ophthalmic nerve, maxillary nerve, and mandibular nerve. So the trigeminal nerve has 3 different areas. One is supplying the ophthalmic region, that is the V1. The maxillary nerve is V2, and then mandibular will be supplied by the V3. So in the image you can see it is clearly denoted that there are 3 areas which these 3 nerves are supplying. So this nerve, the trigeminal nerve, is responsible for facial sensation and motor function like chewing, brushing teeth, or eating, like talking, or whenever there is any activity. So that will be causing pain. So this facial sensation and motor functions like chewing are handled by the trigeminal nerve. So trigeminal nerve has 3 parts: ophthalmic, mandibular, and maxillary. So the image reference is given. So coming to the types of trigeminal neuralgia. So we understood that there is a problem in the trigeminal nerve, and the areas where it is supplying are the olfactory, mandibular, and maxillary region. When we think about the types, one is type 1 and type 2. Type 1 is classical one, where sudden intense shock-like pain is being noticed. Sudden intense and shock-like pain is noticed in type 1. That is a classical feature. Type 2 is atypical. So here there will be constant aching or burning pain will be seen. Type 1 is very specific clinical manifestations will be seen, like sudden intense shock-like pain, and this is a constant aching and burning pain will be in the atypical nerve. So it may be classified as primary or secondary, where the primary is idiopathic. The cause of this trigeminal neuralgia becomes unknown, and the secondary is due to the underlying cause. If we suspect something, any injury or any tumor compressing the mass, or tumor compressing the trigeminal nerve, these symptoms might get resulted. Or if there is any surgical intervention being taken, handled, or the patient has undergone any facial surgeries, there might be a trigger in the trigeminal nerve. So these are the types of trigeminal neuralgia. One is sudden intense shock pain and constant aching or burning pain. So coming on to the conclusion part, we need to know that Trigeminal neuralgia is a sensory motor problem where it will be happening with the sensory problem where the trigeminal nerve serving the facial region is being affected. There are looking on to the anatomy, there are the trigeminal nerve has three main branches, olfactory V1, V2 and V3. Coming on to the types of trigeminal neuralgia, there is type 1 is classical, type 2 is atypical and also can be classified as primary and secondary. We will continue the topic in the next lecture.